Hello and good evening. Welcome from hot and sweaty London. It's such a delight to be here with you tonight. Thank you for spending your evening with us talking about monkeypox. I'm Will Nutland. I'm one of the co-founders of Prepster and the Love Tank, a non-profit health and well-being NGO based here in London. And I'm really happy to have Matteo here with me. Matteo, please say hi.
Hi everyone, I'm Mateo Prohaska. I'm a consultant scientist and epidemiologist with the UK Health Security Agency, and I work in STI outbreaks, STI control and prevention.
Thank you, Matteo. So tonight's event is run in conjunction with the UKHSA, Prepster, the Love Tank, our partners at the GMI Partnership and Outreach Programme that works with gay and bisexual men across the whole of London. And I want to also have a big shout out to our partners at Grindr who kindly helped us advertise tonight's event. We're really cognizant that whilst Matteo and I are based in London, that we are expecting some of you to be tuning in from other parts of the world. It's great to see you here if you are not in London. But please bear in mind that lots of tonight's conversation is going to be UK focused. If you are from outside of the UK and you are a public health activist or a community health activist, we really welcome you to put comments in the chat, either on Facebook or on YouTube, that help people to understand where they can go to get some help and support about monkeypox. So a couple of things just to get the ball rolling about tonight's event. Firstly, this is a live broadcast, but it's also will be available as a post record, both on Facebook and on YouTube, so you can catch up on everything after tonight's event. We welcome your questions, your comments, and you can put them straight in to the chat function, either on YouTube again or on Facebook. This is not the forum to be talking about Bill Gates or 5G or any other conspiracy theories. Folks, if we see that in the comments, we will likely just ask you to go away and put your conspiracy theories in another forum. We also ask for your comments to be respectful. We will boot you out if you are racist, transphobic, homophobic, sex worker-phobic, or any other things on which our organizational principles are based. So bye-bye at this point if you want to be nasty to either any of the other participants or to Matteo or I. We ain't going to put up with it. We're going to look at the questions that come up. We're going to include them. Matteo and I already have some things that we know we're going to definitely be talking about. But before we get going, I want to acknowledge that our healthcare workers, our community health organizations, people like Matteo, people like myself and my team have just come out, as you have, from a god-awful set of lockdowns and public health emergencies, and none of us want to be talking about outbreaks again. I want to salute the health workers, the sexual health clinic workers in particular, the nurses, the doctors, the healthcare advisors, the people who work in the front line of our community-based organizations, the people staffing helplines that are supporting all of us around the world right now, people like Matteo who are involved in outbreak teams. None of us want to be doing this again, but sorry folks, it's time to talk about a new outbreak situation. I want to salute all of those frontline staff who are caring for us and caring for each other. Caring for each other is one of the themes we're going to be talking about tonight. If you're a politician listening in tonight, I can say this is not the time to be defunding either our public health and our outbreak teams, and it's not the time to be defunding our health services. It's time to be pumping lots of money into our National Health Service in the UK, if any of you are listening. One final shout out. BASH, the British Association of Sexual Health and HIV, have been doing an outstanding job. If any of you or anyone who are representatives from the organization, I love you, you're doing a great job. Please keep it up. So, Matteo, let's jump straight in to the stuff that we're going to be talking about. And before we get into the kind of the nitty-gritty of what we're going to be talking about tonight, one thing that we want to say to everyone is that this is an ever-changing situation. The information we're talking about tonight could all change next week. Make sure that you're getting your information about monkeypox from all of those reliable sources that we might expect you to get them from. It's not a good idea to be just doing a quick Google search and going to the latest news story. Matteo and I were just talking about the fact that some of it, even our reliable news sources, aren't always reporting in the best way. Go to reliable news sources and check into the information on an ongoing basis. So, Matteo, let's kick straight off. So I know one of the key questions that people are going to be asking is that, we've just been through 2 years of a public health global crisis, a big pandemic, but monkeypox isn't the same as COVID, is it? Are we going to be expected to be wearing masks, to go into quarantine, to be having great big vaccination programs? Tell us about that, Matteo.
Well, where to start with? I think that was a fantastic introduction. I completely agree with you. It's so bad that we're having to do this again, but again, I'm so glad that we're doing this. And I really think we need to send the right messages to people. This is so different to COVID-19, both in the biological terms, but in the social terms, what it means for us and for our health. I think you were mentioning some potential scenarios that we might be having related to wherein widespread use of masks going into lockdown. I don't think any of those things are measures that are proportional with what we know so far about monkeypox virus. Monkeypox is a virus that originally was transmitted between animals in tropical rainforests, and as many viruses do, sometimes they jump into humans because of animal-human contact. And there's been a number of outbreaks in West and Central Africa in the past few decades. These outbreaks have become more common because of changes in human behavior. And sometimes we have like very discrete importations of the virus into regions where usually you would not have these animals that are carrying the virus. You wouldn't have rainforests, right? So it usually happens that these outbreaks are self-contained or that can be contained with public health action. What we're seeing now is a very different situation. We're having definitely the largest outbreak outside of the African continent that we've seen so far. It's a multi-country international situation that is ever evolving, and it's affecting so many people. And the pattern we're seeing right now is an emerging number of cases in men who are gay or bisexual. And this is very suggestive of new things that are happening around the way monkeypox virus is spreading that we really need to address as a community. And that's why we're here.
So to try and reassure people who are listening in or either live tonight or listening back, we shouldn't necessarily be panicking or getting worried, but we should be alert and we should be responsive.
Yeah. Absolutely. We shouldn't be, I don't think anyone has to have a very deep worry about their personal or individual health. Monkeypox virus is a very mild infection in most cases. It can be more severe in people who are very young. We are trying to see whether there is risk related to women who are pregnant, for example, and we know it can be more severe in people who are deeply immunosuppressed. But most people, even people living with HIV who are undetectable on their meds and have full control of their health, are not at risk, as far as we're concerned, as far as we know so far, to have a severe presentation of monkeypox virus. Of course, this is top of the agenda to make sure that people living with HIV don't have additional needs related to monkeypox virus infection, but we definitely know that this is not an infection that should worry you specifically about your health. This is more about what this infection can mean for us as a community, especially in the way society talks about us and how we see ourselves.
Okay, and you'll see that across the bottom of the screen, I'm going to be putting up sources of information. Our friends at Terence Higgins Trust have a new set of information that's just gone out in the last couple of days that you can go and have a look at. But Matteo, I want to push us a little bit further on this. You've kind of helped us to understand that this isn't COVID. We're not going to have the same responses, but there might be people who are part of these conversations or have been talking to their friends and thinking, if I get it, so what? Is it really a big deal? If I got it tomorrow, so what? What do you think is the answer to that?
I think I don't want people to go into that so what situation, because here's the thing. As public health professionals, what we try to do is to make sure that we control infections. And that includes not allowing new infections to establish themselves. I mean, as gay people, we already have so many STIs. We have gonorrhea, we have syphilis, we have chlamydia, LGV, herpes, shigella. There's so many things on our mind. Our relationship with STIs or with infections in general is somewhat different than the relationship that other people have. And we don't want another STI or another infection that affects us specifically to be added. Just bear in mind, I'm not saying monkeypox is an STI, but it seems like it's sexually transmissible, maybe similar to Shigella. And we know that most people who get infected with Shigella, who are men in the UK, have it through sexual contact, right? And we don't want another infection entering those networks and burdening our health. Some of the symptoms of monkeypox virus can be actually quite annoying. It's an infection that can be kind of long. You can have 2 to 3 weeks of symptoms. You can have a fever. You can have swollen glands or lymphadenopathies, and you can even like be bedridden for a couple of days. And it's not just like the drip. It's not just like a lesion. It can be a bit more serious, and it will affect your well-being. So we want to avoid this spreading around and just not affecting us further.
Yeah. And I think you and I have both been involved in talking to some of those people who've been the early cases. I know this week a couple of friends have just found out they've got monkeypox, and it's not just like having a sore throat and feeling a bit poorly for a day or two. All of the people I know who have been diagnosed with monkeypox have been in bed for a couple of weeks and have quite nasty lesions on their penises, and other symptoms. So this is something that we should be taking seriously, but we shouldn't be panicking. There's no need to be kind of getting massively panicked about this, but we should be paying attention. So I'm just gonna also, something that I forgot to say at the beginning is at the Love Tank we have a fairly new website which is called queerhealth.info. And we've got a new page up there, queerhealth.info/monkeypox. And what we're intending to do over the next 48 hours going into the weekend is to start trying to answer some of the questions that have been coming up. And we promise that we will look at the comments that are coming up. If we don't answer them tonight, we will do our best to answer them on queerhealth.info monkeypox. So do keep checking up on that over the next week or so. I know you've kind of gently touched on this, but why is there a concern now? We both know that monkeypox is something that has been around in other parts of the world for decades and decades. We know lots about it. We know how we previously knew how it was transmitted, but let's come onto that in just a second. We know how people can be treated. We know the symptoms, but why is this a concern now? What's changed? What's focusing our attention?
So when we talk about the history of monkeypox, the initial descriptions of cases, transmission in households was one of the main routes for transmission, right? So we know that people who live in the same house are more likely to transmit the infection to one another. One of the ways this might have been spread in the past is through sexual contact, right? Bear in mind that sexual contact is one of the most popular ways of direct contact, right? So it's not necessarily that this is new. It's less about sexual identity and more about sexual networks. It's more about direct contact. Because of the way we have contact with one another during sex, is usually skin to skin for a period of time, the risk of transmitting the virus to one another is higher. And that means that gay men, especially gay men in dense sexual networks, might be seeing an increase in these cases just because of their patterns of behavior and the number of contacts they have and their transmission. So it's not that the virus has changed. It's not that there has been necessarily a change in the virus. Maybe there's been a bit of a change in the behavior with time, and then the virus has just taken that opportunity. That's what pathogens do. That's why we were in a pandemic, and we in a way still are in the COVID pandemic, right?
So Harvey, hi Harvey, big shout out to you. Great comrade up there in Manchester. Harvey's just saying you can say that again. It's less about identity, but Matteo, I want us to really get this point across. Again, we've been saying, you and I have been saying all week that this is not an STI. This is not a sexually transmitted infection, but it can be transmitted through sex. Just explain that again in a paragraph.
Okay, so think about this. STIs could be controlled if people stopped having sex. Of course, that's not what we want, but from a scientific perspective, sex sustains the transmission of the things we call STIs. That's not the case for monkeypox. If everywhere in the world stopped having sex, monkeypox would not go away because people will still be in the same household. People will still be in contact with animals in areas where this is endemic. So the key definition of an STI is that sex is a necessary behavior in order to sustain its transmission. That's not the case for monkeypox. That's not the case for Shigella, for example. So it's more about the difference. It may sound as a technicality, but it's important to inform control. It has to do with the way this is infected. This is transmitted. For example, think about sex. If you're exchanging fluids, semen, or other kinds of fluids, saliva, we don't know for sure that the virus will necessarily be in semen. For example, it's not about that. It's more like the virus is probably on the skin, and it's while skin is touching skin that the virus is being transmitted. So it could even happen from cuddling someone for a long time. If the lesions are touching each other, you might not consider that sex, and it might not be sex, but it's just a way of transmission. It's more about the opportunities that arise during the act of sex itself.
Okay, and then the other thing that you've said that I just want to push us on a little more is that it's not a gay infection, but most of the cases that are being seen in the UK at the moment are amongst gay or bisexual men. Tell us a bit more about that.
Well, there's a problem with the term as well. Infections are never gay, right? It's people that identify as gay. Yeah. So it just happens that some infections are more common in people who are gay just because of the way they behave. That's what the infections do. They're tied to behavior, right? So similar to STIs, STIs are not exclusive for gay men or bi men or queer men. They can be transmitted to anyone. The most common infection in the STI in the UK is chlamydia, and it's more commonly seen among heterosexual people. Like, it's also in gay men, but heterosexual people, young people who are having lots of sex, they're also having high rates of chlamydia, and that doesn't make chlamydia a straight infection, right? It's just we use these terms easily because sometimes it's easier to convey the message, but we don't really understand what's behind that. This infection is a human infection. Not even that. It's an animal and human infection. You know what I mean?
Yeah, and I know one of our colleagues who works in a sexual health clinic in London put out something on Twitter this week, which was, he wanted to put this new idea there that maybe we're seeing more cases of monkeypox virus in gay and bisexual men because we are so used to taking care of our sexual health. So if we see a lesion on our genitals, we may be more likely to do something about it, just because as communities we're so much more used to talking about sex and sexual health and well-being, and going and doing something about that.
Definitely. I think we saw it with COVID. We see it for so many other infections. Health-seeking behavior, the way you approach health services in order to get tested, to get checked, will definitely affect those plots and curves that you see in the end about an outbreak or an epidemic, right? So I think someone in the chat saying is like, we should really be proud about this. And I completely agree. We should be proud about how good we are as a community in engaging with sexual health services, in going and seeking care, in making sure that we're getting tested. We're actually quite good at it. So the fact that we're seeing a rise in monkeypox cases in the last week is also related to the fact that we have sent such a shout out through so many channels to people saying, if you have a rash, if you have lesions, go get tested. And people have. That's how we're seeing cases, because people are coming forward. And I think we cannot thank people enough for actually doing that, even when they're not feeling necessarily unwell, in order to be diagnosed and support us to control this infection.
And that comment came from Emmett. Emmett, I want to say hi, Emmett. How's your dog? It's great to see you here. Sending you lots and lots of love from London. So, Matteo, I know we've touched on some of these in the very, very early few moments, but let's talk again about what we know or don't know about transmission. And you've talked about that skin-to-skin contact, but again, I just want us to make sure that we're getting this information across as concisely as we can. What do we know, or what do we do not know right now about how we think monkeypox is being transmitted in settings like the UK?
We know so far that direct contact is one of the highest ways of transmitting or acquiring monkeypox virus.
Yeah.
We know this is usually because of the lesions. It's usually because the lesions will have virus. So it's actually during the time that you have lesions that you'll be the most infectious and that you can transmit infection to someone else. So the lesion itself is actually, that's where we take the test. So many times the test will be a sample taken to have a PCR from the area around the lesion. And that's because the virus will be there. And that's how you get it. So when skin touches the lesion, that is probably when we're seeing more transmission. There are other possible options for transmission, thinking about respiratory droplets that we know play a role. We cannot rule out that there's a level of maybe airborne aerosol transmission if someone is quite sick with a respiratory infection added into the systemic complication and presentation of monkeypox. So there's a few things we don't know, but we know for sure that direct contact, especially skin-to-skin contact, is the main route of acquisition.
Okay, thank you. And I just want to highlight what Tom has just said in the chat. So Tom says he thinks it's a bit delusional to suggest it's affecting gay and bi men just about engaging with sexual health services. He thinks that's delusional. It's about our sexual behaviours also. And Tom, I want to acknowledge that is, that is in the conversation too. Matteo, I know just before we came on, we were both talking about how absolutely exhausted we are. I've lost count of how many monkeypox meetings I've been in today or this week, and I know you've been working on this harder than I have and for longer than I have. But let's also stop for a moment and just talk about what the public health response has been to date. I know that I've been in meetings with the World Health Organization, with a European Centre for Disease Control, with your colleagues both in London and nationally. But what activity is going on to kind of focus attention on this as an emerging public health concern?
I think that there's so many elements to it. I think any outbreak response will have some core elements. You need to think about data. You need to think about case definitions. You need to think about services, the frontline workers that are dealing with cases and trying to protect their own health as well. You need to think about vaccines and making sure that people are having PPE if that's needed. But there's also elements related to health policy. The unique thing about infections that are transmitted in sexual networks is that you also need to think about stigma. Well, you always need to think about stigma and health inequalities, but specifically for infections that are transmitted sexually, you need to think about that. Derek on the chat is saying, this reminds me of the 80s. And I think modern public health is founded on the learnings and errors from the response to HIV/AIDS. And one of the things that the UK Health Security Agency has done since day one has been creating the Sexual Health Liaison Group. So we're a group of professionals who all work in sexual health. We all have different skills, whether it's more from the clinical microbiology lab side of things, to surveillance, to public health programs, to program evaluation, to linking with communities and communication. And what we're doing as a function within the UK Health Security Agency is making sure that every aspect of the response is incorporating the needs of our community. It's also a participatory group because the community is represented in the group. And we're making sure that people are talking about this in the right way, that patients are being contacted in the right way, that the right words and right questions are being asked, the media is handling this sensitively, that we have the right approach to comms. So it's a very comprehensive response. It's not like we have not learned. It's actually that we have. I'm actually really happy about the way it's evolving, because I think we're doing the right thing, even having this space that is co-branded between Loft and Prepster and us,
Great. So, and in just a second, I'm going to bring us back to the symptoms. I want people who are listening in to better understand the symptoms of monkeypox that we're seeing right now, because they may not necessarily be the ones that we've historically seen. But I also have a request for people who are listening in who are not from the UK, Emmett and colleagues in the States. If you are able to, in the chat, provide links for information to people who may be either watching this now or watching this as a video later on, it would be really great if you could highlight some of the websites, the help numbers, the places that people can go to from the parts of the world you're in. I also have a suspicion that we might have two or three of you listening in from Beirut and Lebanon. Hi guys, if you're all curled up on the sofa, and maybe if you've got places there that you could shoot people through to, put them in the comments and we will share them as we go along. So Matteo, let's talk symptoms. We know of the 50, 60, 70 cases that have been identified in the UK over the last fortnight, that there are some specific symptoms to be looking out for. If someone is tuning in tonight and is concerned that they may have monkeypox symptoms, what should we be looking out for?
I think the main thing we're telling people to be on the lookout for is lesions on your skin. It's going to look like a rash, first initially like acne, and then it can maybe look a little bit like an ulcer. So lesions similar to herpes or syphilis, that for us will be the most familiar ones. The lesions can be anywhere in your body, okay? Anywhere in your body. But what we're seeing as a pattern is lots of lesions in the genitals, not necessarily because that's the route of entry, just because even in the initial case descriptions of monkeypox, lesions in the genitals, in the mouth, in the face, in the perianal region were very common in the first cases of monkeypox that were described. So it just seems like that's how the infection manifests itself. We're trying to make more studies and more research to understand whether there's any correlation, for example, into the potential way of acquisition and the symptoms that people are presenting, but we're at very early stages, and I don't think we have a full understanding of it to confidently say, this is what we're seeing. I think what I want people to be aware of is that if you have a rash or lesions that seem different or unusual, it's good to call your sexual health service, call your local clinic, say, listen, I have these symptoms, what should I do? Someone will probably triage you, like ask you some questions, and if they think you're at risk of monkeypox, they will arrange for you to go to the clinic in a secure environment and get tested and make sure that you are okay. And you can also have your regular STI checkup when you're there. There might be other symptoms, things like fever, muscle pains, backache. People might also report sometimes having an enlarged lymph node. So this will seem like an enlarged gland near to your neck or your groin. But we're still trying to comprehensively and systematically analyze all this data so that we can actually say, this is the key symptoms, these are the key presentations. Bear in mind that before this large outbreak, there's only been a handful of cases worldwide that have been well documented. I would say less than 1,000 even. So how can you actually make compelling public health messaging with such a limited sample? I'm speaking like a scientist, right? So
that's because you are a scientist.
Because I am, but I'm also a gay man in London. So these things are like very important to me in terms of how would I want someone to explain this to me, you know? We're trying to make the information as readily available and as easy to understand as we can, but we're doing that as we learn.
And so I want to clarify for gay and bisexual men who are in the UK, who are listening into this, who are tuning into this, if they identify symptoms or they're worried about symptoms, they should phone their sexual health clinic. You should not just rock up, because if you rock up and you do have monkeypox, they're not going to, your potential to expose people within clinic, and it's going to cause all sorts of problems in clinic. If you are not a gay or bisexual man and you are concerned about some of these symptoms, is that the same advice, calling your sexual health clinic, or would it be better off for people to call 111?
Well, sexual health clinics are not just for gay and bisexual men. Anyone can be seen in a sexual health clinic, regardless of gender, sexual orientation, or identity. So definitely these are places that are safe for everyone, and everyone is welcome. There are other potential routes of trying to get yourself into the system, maybe calling NHS 111, but this resource has been really overloaded with everyone calling who had a rush. So we're trying to point people towards sexual health clinics.
Okay, and you've just mentioned, and I know from talking to my friends and colleagues who work in the UK sexual health services, many of those services are still reeling from the impact of COVID. They've still got staff off. Some of the London clinics also have staff now in quarantine because they've been exposed potentially to those early monkeypox cases before we knew it was monkeypox. And then maybe some of us who are listening in who are thinking, it's time that I had my next sexual health clinic checkup, but I don't want to add burden to clinics. So here's a reminder that if it's time for your next sexual health clinic checkup and you do not have any symptoms, there are online services that you can use. Ordinarily, I'm just going to, of course, flash up SHL, Sexual Health London here, that provides postal testing. It's a service that I use in between going to actually a physical clinic. I've used it all the way through COVID. It's free, it's confidential, it's so easy to use. So shl.uk, if you're listening, and you're in your London, if you are in London, there's a chance to use that service. And then I'm also just going to flag SHL also has a list of clinics in London. I'm sorry to be London centric here, and if you are not living in London, but people like Harvey, you might also want to put into the chat the available online testing services available in the place where you are. But also, if you want to go to the Prepster website, prepster.info, we have a list on there of all of the clinics in the whole of the UK where there are free NHS sexual health clinics available. And of course, I couldn't get through this without reminding people that if you do not have secure immigration status in the UK, or if you are visiting or you are a student, you are still able to access free and confidential NHS services, regardless of your immigration status. It's one of the things that I am most proud of our NHS, and they are not allowed to report you to the Home Office. So please do not be scared that by rocking up at an NHS sexual health clinic that you will be deported if you are here in insecure immigration status. So, Matteo, I'm just going to wait a second because I see that there are at least 5 comments in the chat. And great, thank you. Lisa is saying in Wales, a Frisky Wales website offers tests. I also see that my lovely friends from Trade have just put SH24 as a way of getting tests. Derek, I'm not sure, Derek, where I immediately see you are from, but there's a link there to your services. Thanks. Emmett is telling us folks in certain parts of the US can go to a great website, takemehome.org.uk. And oh, Jamie, it's so lovely. I knew that you were going to come. You've just received your home kit in-person checkup, mid your in-person checkup cycle. Okay, great. Thank you, Derek. That's confirming that was the Manchester service. So thank you all. Keep these coming through. We really want to make sure that people, wherever you are able. Davey, I've just seen you're asking why is the video not playing. I'm not sure for you why it's not playing. As far as I can see, it is playing. I'm not sure if anyone else can confirm that they can see the video. And again, I just want to fire up there from Emmett that there are a good set of resources there for people on monkeypox if you are in the US. Thanks for that again, Emmett. So, Matteo.
Well, I just wanted to add something really. It's based on some of the conversation we just had relating to sexual health services. They're doing such a fantastic job. They're the true heroes of this. They're the frontline stuff. Many of the first cases were, at first, of course, people were not suspecting that this was monkeypox. So they were seen by several people who have then had to isolate because of exposure, and they're running with a reduced amount of staff. They have a high demand, lots of calls, and they're really trying to work with what they have, limited resources that many sexual health services have. So a huge shout out to everyone who's really working on the front line, and to the British Association of Sexual Health, because they're doing fantastic work linking the UK Health Security Agency with sexual health services that are on the ground controlling this. We completely acknowledge and understand how much work you're doing. It's not like we're just like pointing cases there and just not acknowledging how much effort is being put in place to actually make the flows of patients' tests, diagnostics work.
Absolutely. You know, I completely echo that. All of you out there are doing a fantastic job. Thank you so much. I know it's a really tough time, and I'm going to put that call out again. If you are a politician or you have links to a politician, please stop defunding our great sexual health services. We need to be pumping resources into those services now. We really, really need to be properly investing in our sexual health services and into our surveillance services, because if we didn't have good investment in our surveillance services now, we wouldn't have the great job that people like Matteo and his colleagues have been doing at a really, really difficult time. So I'm just going to put some of the questions up into the chat now, Matteo, because actually these are the questions that we were about to come on to. So someone is asking, for people concerned, are there any tips to reduce the risk of monkeypox transmission? This is a great question, and keep these questions please coming in. Matteo, do you want to try and answer that one?
Yes, I think the first thing is that in order to reduce our risk, you need to understand a risk. So it's really difficult to respond to this answer with information and data just because we're still collecting it and analyzing it. I do think we know some things. We know that direct contact is one of the main routes of acquisition. And multiple sex contacts, multiple direct contacts during sex can increase that likelihood of exposure. However, we don't want to ask people to have less sex. We don't want to have people to stop having sex. Not just because of the moral and social implications of that, but just because it doesn't work. We know that as people who control STIs, we know that that's not the way to go. Abstinence doesn't really work. What we want people is to be equipped with knowledge. What we want people is to be in control of their own health. We need to find a balance between freedom of choice and freedom of infection. It's such a huge dilemma, and we negotiate that as a society. But I think what we need to do is allow people to be informed, and that's why we're doing this kind of streams and lives. You know, we are asking people to be hyper vigilant for their own bodies. If you have lesions, rashes, genital ulcers, anything that looks out of the ordinary, just call your sexual health clinic and be screened by the phone and see whether you need a monkeypox test or not. It's the way you can actually help us to control this infection, make sure that we're aware of the cases, gather more information about it, so we can inform the public health response. It's also so important that people are aware that it's an evolving situation. The things we're saying now, the things that we're saying as advice now, can change in the next week, in the next 2 weeks, as we identify new information, and that's why we're trying to keep these events frequent.
So, Matteo, I'm going to ask you the question that I was going to ask you at the end, but it feels like the right time to ask it. And you can ask me the question if you want that you asked me before everyone came on. There's been talk in some of the networks that we've been involved in of the potential dangers of groups of people getting together, particularly where groups of people might get together and use drink or get high and then start making out, even if there's not sex spaces. And we know that there's a big festival coming up, a 2-day festival coming up that's going to attract lots of queer people in London in a week's time. I know you have a ticket to Mighty Hoopla because you've already told me. Are you still going to go?
I am so excited to go to Mighty Hoopla. I will be going to Mighty Hoopla. That's my personal choice. I am in a monogamous relationship. I'm going there to have a good time, listen to music, dance, have a drink, sit on the grass. I will maybe think about whether I want to be in a closed tent dancing with a lot of people just because I want to protect my health. That's not necessarily something I'm telling everyone should be doing, but that's what I'm thinking about it. That's the way I'm thinking about it. If I were single, if I were not in a monogamous relationship, I maybe would withhold from having multiple new sexual contacts just because I want to avoid the experience of going through the monkeypox pathway right now, which is a bit annoying because you will have to go and get tested, and then you might have to receive some calls and have information, and just you might have to isolate. The guidelines currently are saying that you need to isolate for 3 weeks because we're really trying to control transmission until we know better. It might be that the guidelines change at a further stage, but right now that is the public health advice. That's the best evidence we have. So I would just like to avoid that situation, and I would like to avoid getting sick. So that's my personal choice. But I will very much still go to my hoopla and do things that I feel like are not risky. How about yourself? Have you changed your behavior in the past few weeks?
So I don't have a Mighty Hoopla ticket, and I'm actually going to take a couple of days rest because I really, really need it. But someone asked me on Twitter in the week, I'm thinking of going to the theatre next week. Should I still go? Well, I went to the theatre the night before. The person asked me that, and like you, I'm going to measure up the things that give me pleasure and joy, the things that keep me thriving, versus the potential risk. And actually, I don't think there's much of a monkeypox risk of sitting next to someone in the theatre. There's potentially a COVID risk, and I noted that I was one of very few people in a big theatre who was only wearing a mask. I'm going to go to Glastonbury Festival in I hope 3 weeks' time. I'm part of the outreach crew there, and there's going to be lots of gay people lots of gay men in the space where I'm going to be, and I expect there'll be lots of gay men who are snogging each other. Will I still go into that gay space? Absolutely. Will I probably make out with a couple of hot guys there? Probably. Would I go to a great big sex club in London right now? I doubt it. But that's more of a reflection where I am within my relationships and what I do. Had you asked me that question 15 years ago, it would be a lot harder for me to say that I wasn't gonna go to one. But like you, I'm balancing up, pleasure and risk, and that's what we all need to do. And I want to give again people who are listening into this a reassurance that I don't, there are not calls for us to start closing down venues and events, and in fact quite the opposite. I think all of us who are involved in these public health discussions know that is not the right thing to do. Let's have that nice balance going on. But Matteo, you've mentioned earlier on, and you've kind of just alluded to it now, testing. So if I had let's say lesions on my genitals that were unusual, I'd called my clinic. My clinic had pulled me in and suggested that I go and have tested. What kind of test will I have?
So the clinic will definitely screen you on the phone. So they'll be asking, what kind of lesions do you have? It may be that actually what you have is genital warts. It might be that what you have is probably the same herpes you had before. If it's like a rebound of herpes, that can happen. It can be like an happy rash. I don't know. They will be asking questions related to that. If they think the lesions or the rash you have is compatible with monkeypox, you'll be invited for an appointment, probably as soon as you can go and that they can accommodate for you, and they'll be taking a test. This test is a test to identify the virus, and it's usually a PCR test that's processed in a laboratory from a sample they take from you. The sample is usually a sample from one of the skin lesions. So someone will be doing a little procedure on your lesion to take a small sample, similar to what sometimes they do if you have a syphilis ulcer, for example, and they will send it to a lab. In some cases where there are more systemic manifestations, like a fever or like body pains, they can also take a throat swab that is also sent to the lab for the similar kind of analysis. Then I can tell you more about the experience that you would have if you go through that. I think that'll be really, really helpful for people. So what will happen afterwards? Your test will be processed by the UKHSA Security Agency in high security labs. There is a key consideration here. When you go to sexual health services, your data is anonymized. So it's not linked to your GP records. It's not shared. And nothing is changing with monkeypox in terms of your STI data or your HIV data. For your monkeypox test alone, that test, because of the public health threat that this represents, might be traveling with some personal information, including potentially your name. And this is just because we want to make sure that people can call you back from the Health Security Agency to make sure that you are being interviewed, linked to the right kind of care, giving the right isolation guidance, right? So there might also be an element of people asking you about your contacts, including your sexual partners. So if the sexual partners are identified during the interview, your local health protection team might need to contact them as part of partner notification or contact tracing. During the call with your health protection team, you can actually tell them how you would prefer that these people are approached, because it can be so sensitive. We just want to make sure that people are also negotiating the way they want partner notification or contact tracing to happen. But this is sort of the experience you would have if you go to a clinic.
Okay, so let me be clear. If I had found out, if I had got those lesions, I'd called my clinic, I'd gone in and tested, and I tested positive, I have the opportunity to give those health professionals the details of the people I have had close contact with, maybe the people I live with, if there's been very close physical contact. And then they will they will contact those people on my behalf and encourage them to go through, maybe look for symptoms, go for testing. Will those people I've been in close physical contact with be asked to quarantine?
It will depend on many things. It will actually depend on the nature of contact, right? So we have because of resources and the likelihood of people actually turning positive after exposure, after being in contact. There's different protocols for different types of contact. Usually sexual contact during sexual activities, including from kissing to anal sex, will be probably the higher risk just because of how we know this is transmitted. So it might be that the local health protection team does an evaluation of this contact and requests a level of tests or isolation or be on the lookout for symptoms. So there's elements to that, and your local health protection team will be the best person to inform you around that.
Okay. So Matteo, I'm also just looking through the chat, and I think Derek is making some nice comments. Derek is saying he'd be careful of going to saunas, and also he's asking, I think it's a question about what about Grindr hookups. And in the Grindr hookup situation, this was one of the questions that I tried to answer on Twitter across the weekend when someone said, what would I do? And I answered that right now I probably, or at least across last weekend, because of how much information was changing, I would probably be really careful personally. I'm not telling other people what to do personally of having a new hookup. But if I did have a hookup, there would be two things that I would do. One is that I would ask my partner if they had any of the recent symptoms. And then I would ask them, I would make a request to that person without judgment, that if in the next couple of weeks they developed any of those symptoms, I would want them to tell me. I would want them to get in touch. And I think this is what I was alluding to at the beginning about looking after ourselves and looking after each other. There are ways that we can talk to our partners, the people we're in close contact with, that's about respect and looking after each other. And I know that not everyone will feel safe asking for that information. I know it's not everyone will feel safe about going back and telling some of their close partners, close contacts, that maybe that they've been diagnosed with monkeypox virus. But you've really helped us, Matteo, to understand that there are professionals who can do that on our behalf, and they don't need to know that we are the person that they're talking about.
Yes, absolutely. And we have been working with people who will be on the phone with you to make sure that they are asking the right questions, the right language, and that they are being really sensitive with information. To be fair, they already are, because this is their job. But sometimes the sexual element is a bit different. And since our community continues to evolve and change the way we refer to one another, we define to one another, we're trying to make sure that we are all up to date as an organization, really.
So Nick Maxwell, it's lovely to see you on here tonight as well. And Nick's asking, is there any information on where the big clusters are? Are they London or Brighton? Are you able to give us that information?
I don't have the latest information right now, because it changes every day, and we're trying to make sure that the public is completely aware. But as with many infections that we see in gay and bisexual men, it will be demographically driven. It means that places where you have more gay people will have more of these infections. And since we're seeing that the larger number of infections are being seen in gay men right now, well, of course, London and other large cities are places where cases will be emerging. I think similar to the beginning of the outbreak and to the latest information that is publicly available, London continues to be the predominant area where we're seeing transmission.
Okay. And I also see that Nath has asked, sorry, did I say that was, no, that was Nick Maxwell. Sorry, there are two Maxwells. Nath Maxwell. Do they ask for names and numbers of the contacts, or do they ask you to contact them? I don't feel comfortable giving this information out due to how I met them for my job, etc. So that's a nice question for us to help people understand.
Absolutely. So there's an activity called contact tracing, in which they will have to ask the people that you were in contact with, and they will have to try to contact them. you can negotiate that contact tracing with the person who's on the phone. I would strongly suggest that you do not disengage from that process just because other things will be offered to you regarding to the information you need for your own isolation, to the need for a vaccine if that's ever in the equation, to additional treatment that you might need to receive. So if you decide to just cut off all contact just because you're scared of that possibility, you will lose the opportunity to be engaged in other actions. So I think people need to know that you are in control. As a person, you are in control. So do engage, do have that conversation, and do say that you have those concerns. And then maybe a solution can be found where people can meet each other halfway. So it's just useful to have those conversations. The people you will be on the phone with are experts at their job. They've done this for so many other outbreaks, and they will know how to handle this sensitively.
There's some great conversation going on in the chat, and I'm gonna put them on the screen, Matteo, so you don't have to go through them. But before we do, there's one other question I want to make sure that I've asked you, and this is around, again, a concern that I've heard from people. So, if someone is living with HIV, are there any additional risks? Are they more likely, if they're exposed to monkeypox virus, are they more likely to become infected? Are there any issues for those folks who are living with HIV who should be additionally concerned about?
So far, what we have seen is that people who are deeply immunosuppressed are those that are going to have a more severe infection. And that's not necessarily anything we've seen in the UK, but more something that we see from data from previous outbreaks in other countries. Right now, we're trying to generate as much data we can about HIV and monkeypox co-infection. Definitely the British HIV Association did a rapid communication thinking about the considerations to be had related to vaccines and antivirals, and that piece of work is evolving. So there's a lot of work being done around this. I think at this stage, we do not think that people living with HIV are at increased risk for severity, but we're really, really measuring it so that this could continue to be the case, and that the message continues to be the case. So we'll keep you updated as we continue to do the investigations.
So as we said right at the beginning, this is changing. This is rapidly emerging. Keep coming back to the websites that I'll flag again in a moment. We will be probably doing another forum like this in a couple of weeks' time. So I hope we will, and we will be able to keep people updated. So if you want to come back, we will publicize any more of these events that we do. Jamie, it's so lovely to see you. You've got a question about smallpox vaccine. And you're saying that those of us who are a bit older and for some jobs have had the smallpox vaccine, how does this affect monkeypox in terms of being likely to be less ill, impact on symptoms, ability to pass it on? All I've seen is an 85% question mark effectiveness, and does that mean anything in relatable terms? That's a really great question, and you know, those of us who are slightly older or have lived in other parts of the world may have had smallpox vaccine. I'm old enough to have had it, but didn't get it because I had eczema when I was a kid, and that meant that I was unable to have it. So, Matteo, any thoughts on this?
Definitely, we know that smallpox vaccination is the same vaccine that is usually used to control monkeypox outbreaks. However, because of the small number of, and this is based on some of the evidence collected at the beginning of the initial monkeypox outbreaks in the 70s and 80s, where there was some identification of protection using the smallpox vaccine. But for example, with COVID, we generated so much information because we had thousands and thousands of cases that we were able to give really good estimates of the efficacy and effectiveness of vaccines, right? Even real-time generation, like the UK Health Security Agency, that did a fantastic work generating world-leading evidence on the effectiveness of vaccines, right? That's not the case for monkeypox because the numbers are much smaller. So in order to actually give an estimate, you need to put things into action. So there's currently work in place to consider the deployment of vaccines and the use of vaccines as an effective but also sustainable strategy. And I think we know it will be the same vaccine than smallpox. So there is an element of potential protection conferred by previous smallpox vaccination, but that's more grounded in what we believe than on what we know for sure right now. As a scientist, I always like to be really grounded in data, and I can have personal opinions, but if you look at the data, we cannot really say for sure right now, and things can change.
Okay, and we're getting a fairly large number of quite technical questions coming in, as always happens towards the end of an event. But let's come to them one by one. Has there been any intel gathered through contact tracing which links to overseas travel from particular locations? Are we able to say anything on this?
We're not, because we're still collecting the data and we're still trying to analyze it. We have data from so different sources that we see pieces of information here and there, but we're trying to bring it all together and make sure that we're communicating this to the public without disclosing anything that is relatable to one individual. I've talked so much about protecting people's information, about confidentiality, about privacy. That's also my duty during this call. So I cannot really go into questions that are related to individual people and small numbers of cases.
Okay, and I think that's right that we do that and are really, really careful. As soon as we start talking about individual cases, that undermines the confidence in people coming forward and helping to gather that really important data. So I've got a question here. Can you say something about the UK, does that say cutoff date of smallpox vaccinations prior to 1971? Would they provide enough protection? And what about people with HIV? I think you might have just covered that.
Yes, I think I just covered it. I don't think we know enough. I think that's being considered, and there might be some analysis underway to support that. But it's a bit complicated because in order for the analysis to be done, you need more cases. But we don't really want more cases to happen. We want to stop transmission. So if we are actually able to control this and go to outbreak extermination, we might never be able to answer some of those questions because of the sample sizes that we will be dealing with. But that would be okay. So there will always be an element of uncertainty when dealing with a new or re-emerging infection. So yeah, for sure.
Okay, Simon, hi Simon. Is monkeypox something you can acquire recurrently, or do you build immunity such as chickenpox, smallpox, etc.?
Again, we don't know for sure. We know that smallpox vaccination protection is long-lasting. So you could make the argument that exposure via infection would also be long-lasting, but that might not necessarily be the case. But in order to answer that question, you would need to have high levels of infection and following people for a long time. So we don't have that context right now.
Thank you. So Matteo, I've been racking your brain for the best part of an hour just on that part, never mind the rest of the day when I've been racking your brain preparing for this. So I think it's time we draw our evening to a close. It's been great to have so many people come and be involved in this. I want to remind you that the Love Tank is developing this page, queerhealth.info/monkeypox. Again, for those of you who are not in the UK, this is actually being developed with international colleagues. So we will be making sure that there's information there that's applicable for as many parts of the world as possible in as many languages as possible. And I'm just seeing, okay, lots of people are saying thank you in the comments. Matteo, any last kind of words of wisdom that you would like to put out to the people who are listening in?
Yes, I think what I've been repeating all day is we're so tired of talking about outbreaks, talking about pandemics, talking about infections after COVID. That is really, really common. Like I have the BBC notifications on my phone, and sometimes I see them and I'm like, oh, I groan because I'm like, not again, you know. But do try to stay engaged and informed from a small amount of sources that you really believe in. That way you can control the amount of information you receive, but make sure you're receiving the right information. That's important because this is an evolving situation. We're learning as we go. And some of the things we're saying today might change in the next few weeks. So it's really important that you stay engaged so that you can keep updated. We will continue to work with community organizations, with professional networks, so that we can make sure that the right information is presented to you in a clear way. But we really need you to engage with it in order for the information to actually make effect and allow us to control this. So thank you actually for your engagement and for being here today.
Yeah, thank you all of you. And a plea back out to you. We want to hear from you at the Love Tank about what we can do collectively, whether that's us as an organization working together with Matteo, with the other organizations, Trade Sexual Health are up there. I know Lisa from Wales, Fast Track City, Cardiff and Vale, all those other people. And tell us what we can do together to to really pass the best information out to all of us as we possibly can. I really want to thank Matteo and his colleagues for helping to put tonight's event on. My great colleagues at GMI. I've seen Joel and other people in the chat tonight. Bless you and thank you for supporting us in doing this. I want to pay massive tribute to all of the GMI and Love Tank outreach staff who are actually out and about in bars and clubs, saunas, cruising grounds, Grinder and Scruff and all those places where they're doing net reach, who are actually out there talking to people and answering those questions about monkeypox, particularly during a time of uncertainty. And once again, I want to pay tribute to our absolutely fantastic sexual health clinical staff for doing such a stunning job during this very difficult time. Please get in touch with us if we can find get any more information out to you. Keep an eye on that link that's right there. And Matteo and I are going to go and have some food, I hope, because I'm really hungry. Thank you so much for joining us. Bless you all and see you very, very soon.
Thanks, everyone.